Now student, we have discussed the muscles of the superficial layer and the muscles of the intermediate layer of the forearm region. Now we will discuss the deep muscles of the anterior compartment of the forearm. We will remove the superficial muscle and the intermediate muscles of the anterior compartment of the forearm. So these are the deep muscles of the anterior compartment regions, which are the flexor digitorum profundus and the flexus pollicis longus muscle and the pronator quadratus muscle. We will discuss each muscle in detail one by one. Student, first we will discuss the flexor digitorum profundus muscle. The flexor digitorum profundus muscle originates from the anterior medial aspect of the ulnar bone. This is the ulnar bone, and here this muscle originates from the anterior and medial aspect. This muscles run inferiorly and passes under the flexor retinaculum and divide into the four tendons. These tendons insert into the distal phalanges. This is the distal phalanges of the medial four fingers. These are the medial four fingers, and this is the proximal phalanges. This is the middle phalanges, and this is the distal phalanges. So the tendons of this muscle insert into the distal phalanges of the medial four fingers. Now student, moving toward the blood supply of the flexor digitorum profundus muscle. So this muscle is supplied by the posterior ulnar recurrent artery. This posterior ulnar recurrent artery is the branch of the ulnar artery, and the ulnar artery is the branch of the brachial artery. So it is supplied by the posterior ulnar recurrent artery. Now student, moving toward the innervation of the flexor digitorum profundus muscle. So this muscle is innervated by the median nerve and the ulnar nerve. Now student, as we have studied the anatomy of the flexor digitorum profundus muscle, now we will overview this muscle as it originates from the anterior medial aspect of the shaft of the ulnar bone, while it divides into four tendons, and these four tendons insert into the distal phalanges of the medial four fingers. The action of this muscle is it plays an important role in the flexion of the distal phalanges, and it assists the middle and the proximal phalanges in the flexion. This muscle is supplied by the posterior ulnar recurrent artery, while it is innervated by the ulnar and the median nerve together. Now student, moving toward the another muscle of the deep layer of the anterior compartment, the flexor pollicis longus muscle. Student, the flexor pollicis longus muscle originates from the medial aspect of the shaft of the radius bone. This is the shaft of the radius bone, and this muscle originates from the medial aspect of the shaft of the radius bone. It runs inferiorly and passes under the flexor retinaculum and insert into the distal phalanges of the thumb. This is the thumb finger, and this muscle insert into the distal phalanges of the thumb. Now student, moving toward the blood supply of the flexor pollicis longus muscle. So this muscle is supplied by the radial artery. The radial artery is the branch of the brachial artery, and student, it is also supplied by the anterior interosseous artery. This is the anterior interosseous artery. This anterior interosseous artery is the branch of the ulnar artery. So the anterior interosseous artery and the radial artery supply the flexor pollicis longus muscle. Now student, moving toward the innervation of the flexor pollicis longus muscle. So this muscle is innervated by the median nerve. Now student, moving toward the action of the flexor pollicis longus muscle. This muscle plays an important role in the flexion of the distal phalanges of the thumb. Now student, as we have studied the anatomy of the flexor pollicis longus muscle, here we will overview this muscle as it originates from the anterior surface of the shaft of the radius bone, the anterior medial surface. And this muscle insert to the distal phalanges of the thumb. This muscle plays an important role in the flexion of the distal phalanges of the thumb. It is supplied by the radial artery and the anterior interosseous artery, which is the branch of the ulnar artery. And this muscle is innervated by the median nerve. Now student, we will discuss the last muscle of the deep layer of the anterior compartment of the forearm, which is the pronator quadratus muscle. Student, the pronator quadratus muscle is present deep to the two muscles of the deep layer of the anterior compartment. So this is the pronator quadratus muscle. Student, the pronator quadratus muscle originates from the anterior surface of the radius bone, and it originates into the anterior surface of the ulnar bone. Now student, the pronator quadratus muscle is supplied by the anterior interosseous artery. Student, the anterior interosseous artery is the branch of the ulnar artery, and the ulnar artery originates from the brachial artery. Now student, moving toward the innervation of the pronator quadratus muscle. So the pronator quadratus muscle is innervated by the median nerve. This is the median nerve, and here it innervates the pronator quadratus muscle. Now student, the pronator quadratus muscle, as its name indicates, it plays an important role in the pronation of the forearm. Student, as we have discussed the anatomy of the pronator quadratus muscle, here we will overview this muscle as it originates from the anterior surface of the shaft of the ulnar bone, and it inserts into the anterior surface of the shaft of the radius bone. So this muscle, as its name indicates, the pronator, so it's pronate the forearm, while this muscle is supplied by the anterior interosseous artery. Student, the anterior interosseous artery is the branch of the ulnar artery, and this muscle is innervated by the median nerve, and the median nerve give branch to the anterior interosseous nerve, which supply the which innervate the pronator quadratus muscle. So student, this was all about the muscles of the anterior compartment of the forearm. In next video we will discuss the muscles of the lateral compartment and the posterior compartment of the forearm region.